Thank you for participating in this history assessment. This is going to be recorded and only my instructor will see that. Do I have your consent to proceed?
Yes.
Thank you. All right. Welcome in today. My name is Griffin. I'm going to be your practitioner.
Hi, Griffin.
Thank you for participating in this assignment. Today we're going to be going over some just general health history questions to determine what level you're at before we start getting into any physical activity to keep you as safe as possible.
Okay.
All right. So like I said, my name is Griffin. If your name and the date, if you don't mind me asking, what's your age
54.
and your date of birth?
9/23/70.
All right. And your gender?
1970.
Oh, thank you.
Not that old. Male.
Male. Okay. And what's a good phone number to reach you at?
617-462-0635.
And what's a good email?
mxrocket@hotmail.com. Two T's.
Okay. And would you happen to know the name of your primary care provider?
Harvard Pilgrim Healthcare.
Would you know the name of your doctor?
Um, Nurse practitioner, Erin Bursey is her name. Erin. It's a woman.
Got it. That look right?
It's a Y at the end. EY. EY.
All right. And what would you say is your physical activity level? How many days per week?
What do you mean by physical activity?
That would be moving at least 30 minutes per day at a moderate level or 15 minutes at a vigorous level per day.
Every day then.
So 7 days. All right. So now we're going to moving into our subjective history. So what is the reason for your visit slash what are your current symptoms?
Shoulder pain and instability.
Okay. You said in your shoulder.
Yes.
All right. And how long have you had these symptoms for?
Uh, couple maybe 2 months.
2 months. All right. Have you had any recent injuries in the last 4 months, either contributing to your current issue or not contributing?
No, I had surgery on the shoulder about 19 years ago.
Okay.
My right shoulder.
Right shoulder.
Yep. And turning over in bed, it seemed to have popped out.
Okay.
Popped right back in, but
So,
but it's now it kind of reminds me of what it was like before I had the surgery. It's it doesn't it's not as stable as it was.
okay. So like you said, it happened 19 years ago, but it's just now flaring up again.
Yeah.
Okay. Moving along to medical history, do any of the following diagnoses apply to you?
High blood pressure,
Okay. Everything else look good?
alcohol. Yeah, I'm just looking at the next one.
Mhm.
Everything else is fine. I You don't have cholesterol on there, so
Okay. You said you have high cholesterol?
yeah.
Okay. And then moving on to our daily living patterns. Are you smoking, vaping, using alcohol or tobacco?
Alcohol,
And then
couple drinks a week.
a couple nights a week,
Couple drinks a week, yeah.
couple drinks. Okay. And then what would you say your screen time is? That would be screen within 1 to 3 feet of you.
I'm sorry, what was that?
What would you say your screen time is? The screen would be 1 to 3 feet in front of you. How many hours per week?
Um,
Or sorry, how many hours per day?
per day, probably 3 or 4.
Okay. And then how have you been sleeping recently?
Fair.
All right. And nutrition, how's that?
Um, could be better.
So you thinking adequate to poor?
Yeah, adequate. Yeah, adequate support is fine.
All right. And then how have your stress levels been lately?
Moderate.
All right. Moving on to current medications. Are you currently taking any of the following and or want to add any others?
Um, Losartan for high blood pressure and rosuvastatin for cholesterol.
Okay. Moving on. What would you say your current goals are for your ailment? That can be short term, term, and then how long do you want to give yourself to recover by?
Long term, I'd like to stabilize my shoulder.
Okay.
Short term, decrease the pain.
Uh, all right. And then is there any timeline that you want to have this done by, or is this just as soon as possible?
Yeah, as soon as possible, I guess.
All right. And then none of the other goals fit you currently?
No.
All right. So now we're going to be moving on to functional demands slash currently what level you have overall in your body. So are you currently playing in any sport?
No.
All right. What would what would you say is your current occupation?
Teacher.
Teacher. Okay, so would that be what you're doing most days is presenting, standing around up at
Yes.
class?
Yep.
Would you say you'd be sitting a lot too?
Yeah.
Okay. Do you currently have any hobbies?
Just announcing sports,
Okay, and how frequently are you doing this?
2 to 3 times a week.
And do you have any current limitations while doing this?
No.
All right, sounds good. Okay, moving on to our review of systems. You filled this out earlier and you didn't indicate that you have any of these currently. Just to go over it again, I'm going to scroll down and you just let me know if you might have missed one or is there anything you want to add that you think could be a red flag for when you start exercising.
Okay.
All right, so starting with general health
Nope.
and the cardiovascular system,
Uh, no.
pulmonary system.
Nope.
All right, integumentary or skin,
No.
gastrointestinal.
Nope.
All right, urinary,
Nope.
immunologic,
No.
reproductive,
Nope.
musculoskeletal slash neurological,
The joint pain, that's
joint.
why we're here, right?
Yep.
I
Okay.
have had vertigo in the past.
Okay. It's a good thing to for me to know. Anything else on this for musculoskeletal?
I don't believe so.
All right, psychological.
Some would say I'm a little crazy, but no.
Okay. Endocrine.
Nope.
There's going to be problems with your hormones.
No.
And then the last couple, hepatic,
Nope.
hematologic,
Nope.
and cancer.
No.
All right, so the last thing we're going to be doing is we're going to do some psychological screening to see where you are out of these 6 stages in the trans-theoretical model for behavior change. So that's going to be how prepared you are to start making these changes to better your situation. So
Okay.
based on these 6 stages, which would you say is most appropriate?
Pre-contemplation.
Okay. So you're looking to or you want to get in to start making those changes? We haven't started making any prior to this.
Correct.
All right, and the last thing we have is the Tampa scale for kinesiophobia. This is going to determine how afraid or intimidated you might be by exercising. So we're going to have a scale of 1, strongly disagree, 2, disagree, 3, agree, 4, strongly agree. And you just let me know which you feel most appropriate for where you are currently.
Okay.
So I'm
Uh,
afraid that I might injure myself if I exercise.
one,
If I were to try to overcome it, my pain would increase.
one,
My body is telling me I have something dangerously wrong.
uh, like dangerously? No. So I'd say one,
My pain would probably be relieved if I were to exercise.
two,
People aren't taking my medical condition seriously enough.
one,
My accident has put my body at risk for the rest of my life.
one,
Pain always means I have injured my body.
one,
Just because something aggravates my pain does not mean it is dangerous.
three,
I'm afraid that I might injure myself accidentally.
one,
Simply being careful that I do not make any unnecessary movements is the safest thing I can do to prevent my pain from worsening.
um, I, I lost track of what the numbers are. Is one high or low?
One means you strongly disagree.
Okay, strongly disagree. Okay. Um, which one are we on now?
We're on 10. So
Okay.
simply being careful.
Three,
Okay, I wouldn't have this much pain if there weren't something potentially dangerous going on in my body.
two. I don't like that word dangerous. I don't think anything's dangerous about my injury.
It can be a little bit misleading.
Yeah.
Okay, pain lets me know when to stop exercising so that I don't injure myself.
Um, yeah, three,
Um, it's really not safe for a person with a condition like mine to be physically active.
one,
I can't do all the things normal people do because it's too easy for me to get injured.
two,
Even though something is causing me a lot of pain, I don't think it's actually dangerous.
three,
No one should have to exercise when he/she is in pain.
one.
All right. I'm going to tally up your results. I don't need anything else from you, but I can tell from this that you are not in a lot of fear of exercise, which is very good. It's a very good starting point. Is there anything else you want to let me know of before we get going, or is this covering everything in your current and past medical history?
No, I think we're good.
All right. Thank you very much.
All right. Thank you.
Stop. This is the self-assessment for the first history video I made. I think the order of the assessment form was all right. I should have asked the client goals earlier before going over the medical history. I think the flow was good in terms of keeping it in chronological order. However, I would have given more options for certain sections, and I'm considering adding a symptom management, seeing a MD, AT, PT, OT if they've seen any of that, and adding some more medications to choose from. Three aspects that I think went well were my introduction and preparedness. I greeted the client with a smile and made the interaction feel more personable. Another area that I think went well was following the flow of the form, as like I said, I think it helps keep it in chronological order. The final area that I think went well was asking broad follow-up questions like anything else you want to add, or giving them a chance to give more of an open question where they could go based off of more than just the answers I was giving them. Three aspects for improvement would be asking better and more specific follow-up questions. I'm definitely going to improve on that in the second video. Another aspect for improvement is going to be slowing down when I talk. I think I talked a bit fast in some areas and made it hard to understand what I was saying. The last improvement would be saying less, and especially saying it less when asking a question. There were some points where I struggled to make a thought, and I would say as a filler word, and I want to do that less for the second and third attempt. This was my first assessment performed, and I think the other assessments are going to be a lot better in terms of precision and verbiage. I think more practice will help. For my 6 lines of thought, psychosocial, I think the client scored low on the Tampa scale, which is good. He claimed he was not ready to make changes, however, so this would be something to follow up on and give him more of a chance to start making some of those changes on his own before coming to see me. Some assessments I would perform would be shoulder manual resistance tests to test the strength, and I would also do a passive and active range of motion to test mobility. He said that his right shoulder is popping out of the socket, or it did pop out of the socket. So, testing the internal and external rotators of the shoulder will teach me a little bit about his stabilizers, mobility, and strength. For the diagnosis, I would refer him to a doctor about the shoulder dislocations. I don't want to misdiagnose him with something, and I think an MD would be more appropriate to refer to him. For the prognosis with exercise and resistance training, I think his pain could go away within 1 to 3 months. I think that's a reasonable timeline for him to get stronger with his stabilizers and overall shoulder muscles. For the interventions, I would train him to get stronger, as well as educate him on the importance of doing these movements and why they're helpful. And for my outcomes, I would reassess strength and mobility every couple of sessions to make sure that we're progressing as efficiently as we need to get him to the point of pain-free. Welcome in today. My name is Griffin. I'm going to be your practitioner.
Hi, Griffin. I'm Beth Francis. Thanks for seeing me today.
Thanks for participating in this. This is all going to be recorded. However, the only person that's going to be seeing this is going to be my instructor. Is that okay with you?
I give my consent. Yep.
All right. So today we're just going to be going over some basic health history information. You filled out some of this already with the review of systems form, but we're just going to go over it just in case we missed anything. Sound good?
Yes.
All right, so section one, general information. I have my name, your name, and the date is the 19th. If you don't mind me asking, what is your age
I'm 55.
and your date of birth?
October 2nd, 1969.
All right, your gender,
I'm a female.
and what's a good phone number to reach you at just in case?
978-479-0031.
And a good email?
francis.beth1997@gmail.com.
All right, and would you happen to know the name of your doctor or primary care provider?
Yep, her name's Dr. Alyssa Handler. Hand. Yep, you got it.
All right, and what would you say your physical activity level is per week? How many days that would be of moving at least 30 minutes at a moderate pace or 15 minutes of vigorous pace?
I'd say 3 days a week.
Okay, perfect. All right, so now we're going to be getting into subjective history. What would you say is your reason for visiting today?
I've been having pain in my neck. Pretty
Oh,
much, that's it.
pain in the neck. Is there like a specific area where you diagnosed with anything?
Yes, I have arthritis in my spine and the C4 and C5. Um, I have deterioration.
Okay. And how long would you say this has been going on for?
Uh, Probably 3 to 4 months.
3 or 4 months? Okay. And did you have any recent injuries besides that within the last 4 months?
Nope,
Have you had any previous injury history beyond those 4 months, including
no,
bone breaks or none of these?
nope.
All right, so next up, we're going to be getting to your goals. These can be short term or long term, and I would love it if you could tell me your timeline for wanting to achieve these goals. So, out of the
As
following
I'm
list,
looking, I think decreasing the pain as soon as possible. Um, and improving my posture is what I need to work on so that that can reduce the pain.
okay. And ADL stand for activities of daily living. Would you say one of your goals is to improve those? That could be going upstairs, reaching for things above the fridge,
Um,
even just walking.
yeah, I mean, better than what I'm doing now, sure.
Okay. But everything else look good other than
Yep,
those goals. Do you have any? You can add any other ones if you like.
no, that's good.
All right, so now we're going to be moving into your medical history. Out of any of the following conditions, would you say you've been diagnosed with?
I have high blood pressure that I take medication for, and I have diabetes,
Okay.
type 2.
Type 2.
Yes.
All right, and moving into daily living patterns, do any of these of the following apply to you?
I have a couple glasses of wine a week, so alcohol, I guess. Um, Nutrition's fine, stress, that's fine. Yep, that's fine.
And what would you say your screen time is per week, roughly, or per day,
Uh,
I should say?
well, I work on a computer a lot, so I'd say 5 to 6 hours a day.
Okay, and how would you rate your sleep quality, nutrition, and stress levels?
All fine, moderate. Yeah.
All right, and you said you are currently taking medications for your diabetes. Would you happen to know the names of these medications?
Yeah, I take metformin and then I take avorstatin
Okay,
and I take, oh gosh, Lipiprosol, LIP something.
okay,
Laproprasil, LIPOPISIL, and that's for the blood pressure.
okay. Perfect. And then your management of symptoms, would you say you're taking any days off to rest and recover from the pain?
No, it's just cold therapy.
Cold
I'm
therapy?
supposed to put an ice pack after I do yoga or
Hmm.
I have, yeah, so an ice pack. So cold therapy is pretty much it.
Okay. Moving into our functional demands, are you currently participating in a sport?
No,
Sounds good. What is your occupation? Is consultant
I'm
still
a
correct?
consultant.
And then the demands of occupation still look correct?
Yes, correct.
And then your hobbies, does that still look correct?
Yeah, yeah.
And you have no limitations?
No.
Perfect. All right, so now we're going to be moving into our review of systems. You already filled this out for me before we met, so I appreciate that.
Mhm.
I'm just going to scroll down to the areas that you highlighted. All right, so we have immunologic, muscular, joint pain, swelling, stiffness, and weakness. This is in the neck, correct?
Correct. Yeah.
Is there anything else you want to add, or is that just basically sums it all up? Is the muscle?
Yeah, sums it up. Yep.
All right. Moving down to musculoskeletal, is that the same thing for this one?
Yeah, same thing. Yeah.
All right, but everything else is good with the review of systems.
Yep.
That's
Yep.
basically just gonna help us keep you safe while you exercise to prevent anything very bad from happening.
Okay.
Next up, we're gonna be moving into our psychosocial screening. So this is a six stages that's going to determine how ready you are to make behavior changes in your life. So out of the following six stages, what would you say you would fall under?
Um, I think action.
Action.
I have a scheduled PT appointment on Wednesday. So, um, and I've been going to a chiropractor, so I'm working on it.
Okay. Well, that's always a good start. And then the last thing we have for you is going to be our Tampa scale for kinesiophobia, which you already filled out. And after I tally it up, you've got a score of 39 out of 68, which is meaning that you have a low to maybe a little bit moderate fear of injury due to exercise, but for the level that you're at right now, I think that's okay.
Okay.
And that's all the history questions. Is there anything you want to add?
No. Mm-mm.
All right. And so if we had time in our next session, I would take you through some objective measures, heart rate, BP, some active and passive range of motion, or some strength tests. But that's all I really need from you to do is the health history. So
All
thank you very
right.
much for coming in.
Painless. Thank you.
This is the second self-assessment for the second health history video. I thought the assessment form was much better, and the added symptom management section helped reveal ways to continue helping the client that they're already doing that we can continue doing to help manage the pain and symptoms. I thought the flow was once again good overall, and moving the client goals up earlier definitely helped me figure out what their goal is at a much earlier time than I had in the first video. Currently, there's not much else I would add or take away from the form. I like where it's at right now. The three improvements I would make would once again be to ask better follow-up questions and be more specific. I still need to slightly slow down when going through each section, as it felt kind of rushed and it felt more like I was just kind of getting through it more than caring about it, which I did care about it, but it didn't necessarily seem that way in the video. I want to make the interaction more personal, and less like I'm, like I said, trying to just go through it and build a better rapport with the client. And this one, I should have done a better job of explaining kinesiophobia, and I should have said something along the lines of, this number means you have a readiness to participate in exercise, and not say that the client had a low fear of exercise. Ending at that point is something I want to improve on, because it felt a little bit weird leaving them on they're a little bit afraid of exercise, which wasn't true. So that's something I want to work on. Three areas that I thought were good were, once again, I thought the introduction and greeting with a smile was good. I did a good job of being grateful for their participation and coming to see me, because we appreciate all of our clients. I once again thought the flow was good, following the assessment form in order and asking the client goals earlier this time made it more efficient overall, and I didn't make the client sit through each question necessarily. And the last thing is explaining what's next was really helpful for the client to tell them what to expect in the future, and I think that is something I'll be adding going forward. This was the second video, and I thought it was much more efficient and personal than the first one. I think I asked better follow-up questions in the first take. I can still improve on maybe asking more specific questions and fine-tune questions and make more personal. Looking back on it, I realized I could have asked just more personal questions. Do you have children? What's your lifestyle? Do you enjoy it? Just make the interaction feel more personal and less like a transaction. And for the 6 lines of thought, for psychosocial, the Tampa scale was a little bit high. We were looking below the 34 range. The client was at about 39, but she said she was already taking steps to create a behavior change. So I think that's good, but that's something we can definitely look back on. For the assessments, I would go through passive range of motion and manual resistance test of the cervical spine to test her strength and mobility. The diagnosis that she was given was arthritis in C4 and C5, which I think aligns with her current symptoms and is an accurate medical diagnosis. For the prognosis, arthritis isn't just going to go away, but I think her pain can definitely be managed within 2 months. For interventions, I would educate her on better posture for her neck and her trunk overall, and then I would train her to strengthen her neck and trunk muscles to help improve her posture and put less stress on her cervical spine, which might alleviate some of the pain. And for the outcomes, I would reassess when needed and retrain or switch training if not seeing the results in a timely manner. All right, good afternoon, Michael. My name's Griffin. I'm going to be your practitioner. We are recording. I'm going to be filling out some of your health history. Only my professor is going to see that. Is that okay with you? Do I have your consent?
Perfectly fine.
All right, so we'll get started. Section 1, general information. Like I said, my name's Griffin.
I'm Michael Johnson, yep.
What is your age
Yeah, I'm 22 years,
and your date of birth?
February 28th, 2003.
All right, and your gender?
A male.
What's a good phone number to reach you at?
305-972-2847.
Okay, and a good email?
Probably Mikey, MIKEY, J0309 at Gmail.
All right, and would you happen to know your primary care provider?
Yeah, Dr. Goldberg.
Okay, can look him up after and get his phone number. And what would you say your physical activity level is during the week?
Probably like 2 to 3 times a week.
2 to 3 days?
Yeah.
All right, so now we're going to be getting into our subjective history. So what is the reason that you are coming to visit today?
So I'm having a bit of like pain in my ankle and some stiffness.
Okay. Is that your right or left ankle?
My right.
All right, and how long has this been going on for?
I would say probably for a couple weeks, honestly.
A couple weeks?
Yeah.
Do you have any of the following medical conditions here? We have a heart condition, high blood pressure, respiratory seizures, diabetes, cancer, stroke, or anxiety.
No, none of.
All right, and then did you have any recent injuries that may have caused this?
Besides the ankle, nothing.
Nothing?
Yeah.
So, and then beyond those last 4 months, previous injuries, bone breaks, sprains, dislocations,
No,
none of
nothing
those?
like that.
All right, we're going to move into your daily living patterns. Actually, first we're going to go into your goals. So you said you have ankle pain. What would
Right.
you say is your short-term or long-term goal?
Just to decrease pain. I'm sorry. Short term.
Okay, and do you have like a specific timeline you want to get that done by?
Yeah, I want to say like 2 to 3 weeks.
All right, and then do any of these other goals, maybe increase flexibility, strength,
I would say improve sport performance.
sport performance?
Yeah.
Do you have a timeline for that?
We can do that for a month.
Okay, within a month. All right, so we'll go back into your daily living patterns. Are you doing any of the following: smoking, vaping, alcohol, or tobacco use daily?
Alcohol use would probably be the only thing.
Okay. And how would you say, how many hours per day are you looking at a screen within 1 to 3 feet of you?
I'll probably say like, I'm not sure, probably like 3 to 4 hours.
3 to 4. All right. And then on this scale for sleep quality of poor, fair, good, or excellent, how would you say you've been sleeping recently?
I'll say good.
Good. And nutrition?
Adequate.
And how would you say your stress levels are?
Low.
And then are you currently taking any medications?
No, not currently.
Okay. All right. And I had you fill out the ROS form before meeting with me, and I noticed you only circled one area of concern. And that would be joint pain, swelling, warmth, redness, and stiffness. Is this only in your ankle?
Yeah, it's only in my ankle.
Are you experiencing anything outside of pain and swelling, or is it just those two?
It's just those two mainly.
Okay. All right. So I appreciate you filling that out ahead of time.
Yeah.
And you looked it over already, but there's nothing else you want to add? Anything else to follow up on?
No, everything's good.
Okay, and so for our last stage of the history, we have the psychosocial screening. So we have our trans-theoretical model here, 6 stages. If you want to read that over really quick and say which one you think best fits you currently, go ahead and tell me.
I'd probably say preparation.
Preparation.
Yeah.
So you're ready to make some changes. You might have made a couple, but not any
Right.
major changes.
Yeah, exactly.
Okay, and then the last thing I have for you is I had you fill out the Tampa scale for kinesiophobia, and your score indicated 32 out of 6, which is good. It means that you seem ready to make changes and you're ready to exercise. That doesn't scare you a little bit. Is that accurate?
Yeah, that's pretty accurate.
All right, so that's all I have for health history. Is there anything else you want to add?
No, everything's good.
All right, so outside of that, normally if we had time, we would go over some objective measures: height, weight, heart rate, blood pressure, some range of motion of your ankle to see, try to identify the impairment that might be causing it, but that's not part of the health history. So thank you for coming in today.
All right, thank you.
This is history assessment video number 3. I thought the assessment form was good overall. I didn't add anything. For some reason, during the assessment, I forgot to go over the section about management of condition. However, the client said he was not taking anything for the pain and he wasn't seeing any ATs, PTs, OTs about his condition. I once again thought the flow of the assessment was good, asking the client goals early. However, I'd like to ask the client goals as early as I did in the second video and ask it a little bit earlier than I did in this one. 3 areas for improvement would be this history felt somewhat rushed. However, I think this was due to the lack of yes answers to my question, which leads me to my next point would be to ask more follow-up questions that are open and not just yes or no. And then going along the lines of that, my third reason would be the final area to work on is going into a deeper dive into each assessment form question to help extract more information, which could help me generate my hypotheses. Because if I go and assess and my hypotheses are correct and I didn't get enough information out of it, then it's going to be hard to generate more hypotheses from that. 3 areas that I thought were good were I think I did a good job of holding eye contact and making more of a personal connection. This was an area that I really wanted to focus on compared to my second video, and I think I did a much better job of it. Another area that I thought went well was making sure the ROS form was correct and the client didn't need to add anything. I did this to really cover myself and make sure the client was as safe as possible. I think I did a better job in this third video than I did in the first 2 of talking about what needed to be filled out in the ROS and what was filled out and asking those follow-up questions. The last thing I think went well was explaining certain areas of the form like the Tampa scale and Trent's theoretical model. I think this helped the client understand more of what I needed from them and made it just an easier connection for the 2 of us. Although this video felt a bit more rushed, I definitely felt more confident with answering the questions that he did have, even though the client did kind of lack some of those questions. Ways to improve in the future would be to ask questions with more confidence and conviction and not be afraid to ask more difficult or personal questions. I think practicing this will help a lot, and even having family members or friends make up information and going over the form again and again could really help. The main takeaway for this assessment video is to ask more specific questions and be more confident in answering those questions. And I think practicing a lot more will do that and should help me get to where I want to be as a practitioner. For the 6 lines of thought, for psychosocial, the client didn't seem too worried about making changes. He said he was between preparation and action, which I think is a good starting point. To begin exercising. For assessments, I would go through a passive range of motion test and strength assessment to determine where the ankle is and what exercises can be done to help strengthen it. The diagnosis would be a lateral ankle sprain is what's causing the pain, and lack of being able to put a lot of pressure on the affected ankle would be what's causing the stiffness of the ankle joint overall. My prognosis is with interventions performed, the pain and stiffness can be reduced and then eliminated in 3 to 5 weeks, which I believe is a reasonable timeline. For interventions, I would train ankle mobility and strength, as well as educate the client on possible braces to wear to help put less pressure on it and prevent it from happening again when he plays basketball, which he said was his goal. And for the outcomes, I would reassess after training to check for mobility and strength and make sure those are improving. And if they're not improving as much as I'd hope, then I would retrain in different modalities to help achieve the best possible outcome for the client.